I have been working here at Open Healthcare Clinic for 9 years now. I love everything about this organization. We are very mission focused. So we are here to provide affordable quality healthcare to our community.
Open Healthcare Clinic is a federally qualified health center where we provide whole care for the whole community. I oversee the behavioral health day-to-day operations, but we also provide medical services, social services. We have dental, pharmacy.
A couple of years ago, we were able to partner with Louisiana Coalition Against Domestic Violence. They came in and did multiple trainings with all of our staff to make sure our staff was aware of what intimate partner violence looked like, the different types of violence, that it does not discriminate based on any demographics whatsoever. Men and women alike are victims, and how wide-ranging the harm of intimate partner violence is.
The Louisiana Coalition Against Domestic Violence is the statewide network of domestic violence shelters and advocacy programs and individuals who are working to end domestic violence all across the state. Healthcare providers are in a really unique position to provide safety resources and to intervene in a patient's life when they are experiencing violence in their home. By being able to talk about violence, by being able to understand the connection between someone's relationship and their health, they can make that seamless connection that somebody needs in a moment where no one else can do that, right? And that's really what this project is about, is being able to take every opportunity that we have to get somebody safe. We've been in partnership with the Primary Care Association for a couple years now, but we were able to recently formalize that partnership into an MOU. So with that, we are able to provide all of the technical assistance that is needed to local programs and local healthcare centers to create these referral relationships with each other. So we can provide everything from clinician and staff training, policy development, protocol development. We can provide screening tools and a whole host of other things to help get these connections made and keep them strong so that practitioners on both sides are able to refer to each other and easily and seamlessly get survivors the help that they need.
The Louisiana Coalition Against Domestic Violence is a statewide organization that we are proud to have a partnership. They work with multiple organizations across the state in an effort to reduce domestic violence and intimate partner violence across the state. We're really excited about the partnership and our efforts to make sure that we're providing preventive care, behavioral health care, and meeting the needs of our patients. We recognize that unfortunately Louisiana has some of the highest rates of intimate partner violence across the nation, and so we recognize that our patients may actually need services provided through domestic violence partnership organizations, and so entering into this partnership will allow us to meet all of the needs of our patients.
We've been recently partnering with the Louisiana Coalition of Domestic Violence and also the Irish Shelter to expand our resources for domestic violence or patients that's experiencing intimate partner abuse. Recently, our partnership has expanded into our medical facility where we're actually implementing a universal screening protocol called the HIT screening, where we're able to capture patients that may have experienced intimate partner violence and link them to the resources and care at the Irish Shelter.
When we talk about maternal mortality, we often think about the obstetric causes of maternal mortality, hemorrhage, preeclampsia, those types of things. But what folks fail to realize is that homicide is a leading cause of maternal mortality. So just like health providers can screen and look at certain risk factors for medical and obstetric causes of maternal mortality, we also need to get to a point where they're able to screen and look at certain risk factors for violence and homicide, and we can address those in the same way.
Our health centers are active members of their communities. Many of them have been in the communities for decades, so patients and families trust not only the health centers, but trust the providers that are working in the health centers, from the front desk staff to the physicians to the nurses. And so an individual who may be dealing with intimate partner violence within their home, within their family, coming to a community health center and getting that care and getting that connection is a great step for all of our patients.
I would say as far as education and awareness, it has been very great within our medical setting and also behavioral health to expand our knowledge of what domestic violence look like and also how to respond to it from a behavioral health aspect. Our patients have been benefiting from it because we have resources that's available in our bathroom stalls, that's available in our medical rooms to be able to educate them on who they can contact when they're experiencing intimate partner violence. But also just around the board, we have been increasing our responses to it in the clinic setting.
I think there's a role for every healthcare professional to play in this. I think that everyone needs to be able to recognize and understand the connection between health and safety and health. However, I do think that health centers are really uniquely positioned because they are seeing so many clients and because so many people come to them for help. And so the resources that they have to be able to really help when somebody needs it, and also just the fact that they exist where so many other health providers might not be, right? So being able to serve somebody who lives in a rural area or somebody who doesn't have access to other types of health care, that's really important.
I would definitely recommend any organization that has an opportunity engage with the Louisiana Coalition Against Domestic Violence in a partnership to ensure we're able to provide more education, more resources, and more services to people. Once you do, you will see how widespread the issue of intimate partner violence is and how just asking the question can do so much to help someone. So after our partnership with Louisiana Coalition Against Domestic Violence, we were put in contact with IRIS. And through that, we entered into a MOU with them where our mobile unit goes to IRIS and we provide medical and dental services to all of the persons who are on site there, families. We are able to serve the entire family on our units, and they are mobile clinics. So anything that we would do in a medical unit, in a medical center, or the dental clinic, we can do on our mobile unit.
Any healthcare provider or domestic violence program who wants to learn more about creating these partnerships and to learn more about the connection between domestic violence and health, to reach out to us at LCADV or to our partners at LPCA, and we would be happy to help. I know it can sometimes be overwhelming for a health center to think about revamping their entire policies or creating new procedures or reaching out and creating these new partnerships. And so that's kind of the role that we can play, is we can come in and make it as simple as possible for you so that you can focus on serving your patients and serving your clients.